I'm Dr. Nidhi Khera from Apollo Cradle, Motinagar, specializing in high-risk pregnancies. What is high-risk pregnancy and the support for it? Most of the times having a baby is a natural process, but not all times the process will go on smoothly and uneventfully. A pregnancy is considered high-risk when there is an increased potential or an increased chance to have a complication or a potential problem that could affect either the mother or the baby or both. Now, these situations could occur against a background where there already are certain high-risk situations to begin with prior to pregnancy, or they would occur de novo during the ongoing pregnancy. Yes, the word high risk may sound scary, but if appropriately managed, we can optimize the outcomes. And having a high-risk pregnancy does not necessarily mean that you will always end up in complications or problems. So where does these high-risk situations arise from? Pre-existing ones could be if the maternal age is at extremes. Either you have somebody who's too young or the mother is too old. Second, there could be certain medical disorders that the woman is already undergoing through. Things like high blood pressure, sugar, a kidney problem, a lung disorder, some heart disorders, a seizure disorder or epilepsy, certain autoimmune diseases, chronic infections. Now, having these to begin with can have certain implications during the course of pregnancy for this woman. There could be a family history of certain genetic disorders. There could have been previous adverse outcomes or not so comfortable situations, like having a previous preterm delivery, having a child that was stillborn, having been on certain drugs or medicines, having had 2 or 3 or even more abortions. Now, all these would make her at high risk for the next pregnancy. Then there could be a whole lot of conditions that could arise de novo during pregnancy. Now, this could be if she's carrying on multiple gestations. Say, supposing you're carrying twins, you're carrying triplets, or you're carrying even a higher number of pregnancy. Maybe if you've become more frequent again and again, maybe if the time interval between the 2 pregnancies was very less, then again you're going to go down in the nutrition, and that would pose a higher risk situation. If there is development of high blood pressure during pregnancy, development of abnormal sugars during pregnancy, or what we call gestational diabetics, these again are high risk situations which need specialized care. Other things that would include a low-lying placenta, which would make the woman more prone to bleeding abnormally during pregnancy. There could be certain abnormalities with the baby as well, like there could be a structural or a developmental abnormality. There could be certain issues with the growth of the baby. If the growth of the baby is not going on the right curve, if it is occurring less during pregnancy, if the waters around the baby are less, or if the blood supply going to the baby is less, all this could pose additional risks to the baby. Even if you do not have a pre-existing health problem, it would certainly be a good idea to plan a visit to a gynecologist before planning the pregnancy to assess the situation better, and there could even be suggestion to start some measures to potentially decrease the risk of having complications during pregnancy. Some of these measures could include to start taking folic acid supplementations during pregnancy, to be getting the proper immunizations before you plan a pregnancy, to be getting on to a healthy diet and maintaining proper weight and exercise schedule prior to pregnancy, which can be continued during pregnancy, and definitely the avoidance of certain drugs, tobacco and alcohol, to say the least. For a high-risk pregnancy management, it is very essential that you have a team taking care of you, and this team involves a good setup to begin with. This team involves an expert who specialized in taking care of women with such sort of complications anticipated, a trained neonatology team and a good NICU facility, round-the-clock nurses who are specially equipped and trained to deal with this kind of a situation, as well as other healthcare professionals. One will need to have more visits in the management of a high-risk pregnancy, and would definitely need to be on a stricter surveillance, with probably the need for more investigations as well. With your doctor, you would need to discuss what are the symptoms to watch for, what would be the warning situations, and when to reach the hospital immediately in case any such emergency arises. You would also sit down with your doctor and would be given a plan of management that would be formulated and individualized as per your situation, and would definitely need to stick on to that plan to optimize the outcomes. But yes, if high risk pregnancy managed well, managed properly in a good setup, it need not forever be a high risk pregnancy, and you would soon have a good outcome. With Apollo Cradle, you and your baby are always in safe hands.